Today I want to talk about infections in the female genital tract. Some of them are sexually transmitted, but not all. And some of them are just superficial on the outside, others are deep and cause problems like pain. Starting with superficial, what a woman will notice is irritation at the vaginal opening or on the labia. It might be itching, burning, a combination of both. There might just be a rash. There might be bumps there. It might be painful, excruciatingly painful. These can be anything from a yeast infection to a bacterial infection, herpes, warts. So there's a lot of different things. And so it's very difficult if you call your gynecologist's office and say, I have this problem, can you call me in something? You really are going to end up needing to go in and let someone look at it. Even if you think you've had it before, it could be something different this time. So for superficial infections, especially yeast, most people think of yeast infections as being in the vagina. Well, you can have a yeast infection inside your vagina, but you're not going to feel it probably because there aren't a lot of receptors inside the vagina for pain or touch. That's why we can have babies vaginally. Most of the receptors are on the outside at the vaginal opening and at the labia. So most women who have symptoms of itching and burning and think they have a yeast infection is because their symptoms are on the outside. And I can't tell you how many times a day or a week I go through this, but it's okay to treat yourself for a yeast infection before you come in. But if you're gonna do that, do it properly. Get a yeast infection cream, a 7-day cream at the pharmacy. There are products out there that say for itching and burning that aren't yeast infection creams. And so you're wasting your money to get those. So get the 7-day cream for yeast infection. Even if you can only get it in vaginal applicators, put it on your fingers. Don't waste it by squirting it up inside your vagina. The problem isn't there. It's at the opening and the labia where you're having the symptoms. Put the cream where the problem is. And do that at least twice a day. 3 times a day is better for at least a week, maybe 10 days. Yeast invade the skin. They invade the epidermis and dermis. It takes a while to get rid of them. It's not just, you didn't get it overnight, it's not going to go away overnight. So do that. Put it where the problem is, do it for at least 7 to 10 days, and don't waste your money on products that aren't to cure a yeast infection. If you're not sure, ask the pharmacist. That's yeast. Then there's bacteria. That's harder to diagnose on the outside. Some people have chronic bacterial infections that have never been treated, especially in the groins or under the belly flap. Those we need to look at. Probably that person is due for an annual anyway. We try to pick up on those at the annual exam and counsel people and give them treatment at the time. Bacterial infections are usually bacterial vaginosis, which is a vaginal infection. It can cause symptoms on the outside like burning, and it can cause a bad odor. Usually when people mention there's an odor, it's a bacterial infection. But there's no such thing as it always is this or it's always that. The one thing it's safe to do before you come in is use yeast infection cream. That's all I can tell you. For the bacterial infections, nowadays, What we usually do is get a specimen from the vagina, like a swab, put it in a container, send it to the lab, and let the lab run it for yeast, bacterial, and trichomonas. If it's positive for bacterial, they then do this long panel of different bacteria, all of which are associated with bacterial vaginosis. Who knew? There were so many. And they're not all treated with one antibiotic. So we carefully look at the panel, see what's on there, and then decide, does this person need one oral antibiotic or 2 oral antibiotics? And you know, when you take an antibiotic for anything, even a toothache, it has the potential for killing the good bacteria also in your vagina, which then sets up the yeast to take over and give you a yeast infection. So anytime you take an antibiotic for anything, get the yeast infection cream and use it preventatively or prophylactically on your fingers at the opening to your vagina a couple of times a day to prevent the yeast infection. So back to BV, we have this panel of bacteria, and depending on which ones are positive will determine which antibiotics we send to your pharmacy for you. So I now prescribe the yeast infection cream as well, just to make it easier for people and to remind them they need to do that, even though we tell them on the phone. There's no need to repeat testing unless symptoms come back. And then the testing should be repeated because it might not be the same things or as bad, and you might not need 2 antibiotics. Okay, that's a bacterial infection. A herpes infection is something completely different. A lot of women, we test women to see if they're carriers of herpes when they're pregnant because we would want to give them a suppressive medication the last 3 or 4 weeks to help prevent them shedding the herpes virus when they go into labor so their baby doesn't get it. Other than that, there really are no bad consequences from carrying herpes. Usually, if you're going to have an outbreak, it's one little tiny spot that hurts and then it goes away. You can make it go away faster with medicine, which we can give you. But the first outbreak, your first exposure, could be a doozy, and usually people will say, well, there were bumps, and then they went away and now it hurts and I can't even pee. Yeah, that's not good. And we have you come in and look and treat and test and all that needs to get done. It doesn't cause cancer like HPV. It's not life-threatening. Herpes just is, and 80% of the population has it by the time they're in their 60s. It's just there. I haven't said a lot about deep pelvic infections or even gonorrhea or chlamydia. Hello, the elephant in the room. Gonorrhea and chlamydia are everywhere. They're still out there. We see it. We have several cases a week, every week, and we do a lot of testing for it. Most of the time, it's just in the cervix. Rarely, several times a year, we might have a patient that needs to be hospitalized because it's up inside their uterus and fallopian tubes. Fortunately, that doesn't happen very often. It can cause that person to have tubal damage so they can't get pregnant later in life. That's with chlamydia and or gonorrhea. I think people tend to know more about those than anything else. Deep pelvic infections can, like I said, can be caused by gonorrhea or chlamydia, but more often I see them being caused just by bacteria from the vagina. Maybe from one of that long list that causes BV, and usually we'll end up treating it with a shot of antibiotics and 2 types of pills. And most people will get better within they'll start feeling better in a week, but they often have to take the antibiotics for 10 or 14 days, depending on how long they've had the pelvic infection. You know, if you come in right away and you've only been hurting for a few days, it's going to go away a lot faster than if you've been hurting for a couple of months. The cardinal sign is pain with intercourse, deep pain with intercourse. And again, it's usually not sexually transmitted so much as just bacterial infections that live in your vagina. It's difficult to pinpoint which bacteria they are. The people that do come in with a pelvic infection usually will send gonorrhea and chlamydia. The other sexually transmitted diseases that we test for, if you're someone who wants all of the testing done, is blood work. And for those, it's syphilis, HIV, hepatitis B, hepatitis C, and I feel like I'm forgetting one. Hopefully it'll come to me. Maybe, maybe not. But those are the biggies. We see hepatitis C more than B nowadays, and mostly in our pregnant patients who we're screening them all for that. The people with routine STI testings, usually it's negative, fortunately. We try not to test for herpes unless it's someone who specifically asks for it, because most people tend to go off the deep end if you tell them they are a carrier for herpes. Yet when you tell them they have human papillomavirus, it doesn't even ring a bell. So it's this dichotomy we live with. Most of what's out there is treatable. Don't panic. Come see us. We'll test you. We'll try to explain it to the best of our ability, and we'll treat you. That's our job. Thank you.